All right, so we will give everybody a couple of minutes to join in, as it always takes a little bit of time for people to trickle in. As always, if you are here and joining, a couple of updates. Please make sure you put your name on the right-hand column. Let us know who you are and where you're from. We would love to know who's joining, where everybody's coming from, and how we can best serve you. So if you have questions off the bat or things you want either Jon or myself to cover today, please put that in the right-hand column. We'll wait a little bit, Jon, to do introductions just to give people time to trickle in, and we'll get started in just a second.
Sure thing.
How is it up there? Like, how are you? I mean, obviously we're live, but how are you experiencing everything?
Well, we were talking a bit before we went live. I mean, it's kind of surreal because I've been working really hard, and I'm very lucky. I enjoy spending the extra time with my family, and we're all healthy and safe. So we're sort of, looking out into the world and seeing it turned upside down. And then every once in a while, I'll just remember, in a moment of silence. I think just the other day was just a beautiful day out, and I thought, it'd be a great day to go to a baseball game. Oh, right, that's not a thing.
Yeah.
So that's frustrating.
It's these like little things that, as we start to get back to life, right, that we start our reminders. And one of the things I was telling someone last night, for me, that's been pretty eye-opening is that I think throughout my life, I know and recognize that I'm not the nicest when I'm anxious. And that and I think it's a great topic we'll talk about later, but I'm pretty short with people and I'm pretty snappy, and my emotion regulation goes out the window when my insight does. And, I'm quick to recover and I'm quick to apologize, but at the same time, in the moment, it just happens so quickly. And I think for me, I've found ways to justify it. Like, I'm sorry, that was my OCD, or I'm sorry this, versus acknowledging that this is still not okay, right, for me to respond that way. And I think for me, it's been really eye-opening just because I've seen other people deal with anxiety for the first time in their lives, and the way they get really snappy or the way they get really short, it's allowed me to kind of say oh, okay, that doesn't feel good when you're receiving things like that. And so how can I change my behavior? So there's been, I think, as someone with OCD, there's been a lot of aha moments of insight, just because you've had to see how other people deal with uncertainty when that's not something they're used to, versus with OCD, we've dealt with it a long time, but how do people react and what does that look like?
Yeah, no, that's a really good point. I mean, on the flip side of that, it's also, we all need to give each other maybe even more flexibility than we would have before, because it doesn't matter if you have OCD or not. We're all being squeezed by this pandemic, and whatever your issues are. So with me, kind of like yourself, it often comes out in irritation or just brevity. Yeah. They're just rising to the surface. So whether you have OCD or you don't have any diagnosed condition, the likelihood is that you're going to be exhibiting what we would normally call symptoms. And so on the receiving end of that, it's sure, that's not okay, but also try to see it in the context, because likelihood is you're doing it too, Well,
and that's the thing. I think for me, to be able to recognize oh, it doesn't feel good. I understand why people do it because I've done it for a long time, but I just think it's been eye-opening for me to really recognize oh, I have more work to do around the way I communicate and the way I talk to people when I'm triggered, even if I know ERP and I know how to do all that. Right. We can still work on our communication skills, especially with significant others. And we'll talk about that a lot more today because I think it's very relevant. So welcome, everybody. Please post comments on the right-hand pane. Let us know who you are, where you're from, and we are going to get started. As always, I always want to start with a couple disclaimers. So first and foremost, this is not a crisis hotline, and this is not therapy. This is not intended to replace therapy, but instead it's both myself and Jon joining you today to share our personal insights, thoughts, and hopefully provide a little bit of education and support to those of you who need it. If you're in need of therapy, please contact a local therapist. And of course, if you're in crisis or feeling unsafe, call 911, go to your local ER, or call the National Suicide Hotline. Peace of Mind Foundation and the International OCD Foundation have been working hand in hand to increase the support that we give to our community during this time. And we've really been doing a lot of this through webinars. And so the Peace of Mind Foundation has embarked on this webinar called, I shouldn't say called, but really it's a webinar series, I should call it, that's really about re-engaging. And the purpose of it is we wanted to start to talk about, okay, we've talked a lot about what it's like living in quarantine and living with OCD, but what's it going to be like for individuals with OCD as we start to re-engage in life, or as society starts to re-engage in life, but we still may be struggling if we're living with OCD. And so today's piece or episode from the Re-engage series is going to be focused on significant others. We have Jon Hershfield joining us today, who is the director of the OCD and Anxiety Center of Sheppard Pratt's private pay outpatient treatment center for individuals with OCD and anxiety disorders. He's a licensed marriage and family therapist, perfect for today's seminar, as you all know, in Maryland, Virginia, California, and is a Maryland-approved licensed clinical and marriage and family therapist supervisor. Jon founded the OCD and Anxiety Center of Greater Baltimore in 2015. The practice joined Sheppard Pratt in 2020. And prior to founding the OCD and Anxiety Center of Greater Baltimore, he served as the associate director of the UCLA Pediatric OCD Intensive Outpatient Program and Resnick Neuropsychiatric Hospital, and was a psychotherapist at the OCD Center of Los Angeles. Jon and I have done a couple of events together. One that sticks out the most to me was when we went to Atlanta during OCD week, and you were speaking specifically on mindfulness and OCD. And it was, I think overall you've done so much work. You've shared so much insight from books, texts, workbooks, you name it. Can you give a second to just introduce yourself of what you do, why you do it, and maybe a little bit of why you find OCD and family work to be so beneficial and or rewarding?
Wow. Well, thank you for that introduction. Yeah, it is a mouthful. It's been quite a journey. I got into this business as an OCD sufferer looking for help and support online, which seems quaint now. I mean, everything's online, but this was at a time where people didn't naturally have all of these online services. And there was this email-based discussion board. And so I was going through therapy and I was writing to people and saying, here's my experience. People writing to me saying, oh, well, here's my experience. I started responding to these other people's experiences, and found that to be so rewarding. A combination of that and the wonderful people in my life at the time who were supporting my therapeutic endeavors were like, hey, maybe you should consider becoming a therapist. And then that sort of set fire to this thing that just went into motion and never stopped. So this was in California, and in California it's a very common master's level clinician degree, which is MFT, marriage and family therapy. So I didn't get into it thinking like, oh, I want to be a marriage and family therapist. I got into it thinking I want to treat OCD. I want to do CBT and ERP for OCD. But first I need to be allowed to do that. And so I can do that by getting an MFT. But of course, in the process of getting my MFT, I also learned a lot about family systems and how families work as systems and how the interactions between families affect everyone. And it started dawning on me that this really makes a lot of sense when you look at how OCD is treated, especially when you're factoring things like reassurance seeking and family accommodation rituals and things like that. When one person has OCD in the family, everybody in the family is dealing with that OCD in one way or another. And anybody in the family who's in denial of that is actually inhibiting that person's progress.
Right.
Everybody has to get on board in some way. And one of the things I've seen in practice is that often gets overlooked is how much exposure therapy our family members and significant others really have to do for us to be able to do exposure therapy well, right? They need to give us time and space to write our exposure scripts, and they need to withhold reassurance. And just think about what that means. Like, that all you have to do is say the magic words, and this person who you love, who's obviously suffering, is going to say, and feel relief and be so grateful. You have to choose not to do that. And sure, you're going to try to approach it with compassion, but they might not be real happy with you at the time. And they say, come on, just all you have to do is answer this one question. I promise it's the last one. But you're doing it knowing that, okay, this is what they need to do to get better. The compassionate move here is for me to sit with my discomfort of watching my loved one squirm. And there's a habituation process with that as well, right? They get better at it. They don't become callous. They just get better at understanding, like, yeah, this is what it feels like when my loved one is suffering. And I have to, they're the variable. I have to be the constant right now.
100%. And I think that's actually a wonderful starting point for us to just hop right in. And I'm going to start with a couple questions that were submitted in advance. And then, as always, if you guys have questions, please put them on the right pane that you see next to us so that we can answer those as we go along. But, it's been interesting for me. So I'm engaged and I'm getting married soon, was supposed to get married, pandemic happened, so we had to push it back. But it's been, I'll speak candidly, and I always do that, so that's nothing new. But, my parents have lived with my OCD since I was 15. And so they've had countless years, right? Well over a decade to really understand OCD treatment. They were involved in it from the beginning. They were at the treatment center with me. They really were, they really understand how detrimental reassurance can be. And they also, I think over the years, had to do their own work because, as you mentioned, right, you have to do your own work to be able to hold what you need to hold for the people that you love. Otherwise, again, giving in makes more sense or feels really difficult and isn't something you're willing to do. But it's been interesting as I've entered a relationship where my fiance, I love him to death, but like anxiety is really hard for him. And as it is for anybody, and it's foreign, right? He hasn't lived with, I have to remember like, okay, he doesn't have the background my parents have because he doesn't have 15-year history or more with OCD and with my treatment. But what I've learned is just how difficult it is for him to sit with the discomfort that he feels like his actions are causing me.
Mm-hmm.
Right. So when he, as you just mentioned, when someone we love chooses to not give reassurance for that greater good, that short-term feeling for them is probably really terrible, right? Like they feel like they're letting us down. They feel like they're causing us discomfort, that they're not just fixing something when that's like innately when you love someone, you want them to just feel better. You want them to fix it. And I'm curious for those watching, the family members who can resonate with this and can really say like, it feels terrible and I feel like I'm letting someone down. How do they push through that? And how do they learn to live with that anxiety and discomfort that probably comes with not doing what might make someone feel better in the short term, but makes OCD worse in the long run?
I think it's important to start from the perspective of understanding that it's totally normal to have the drive to accommodate. That's what relationships are. They're kind of strategic accommodations, right? So you get in, you start by dating someone and you're basically saying, I'm going to offer you this much of my mental space and this much of my time that I was previously offering, my pets or my friends or my coworkers. And then you move in together and you're like, I'm going to accommodate your need for this amount of space and your need for these kinds of foods in the fridge. And we do it willingly and lovingly because it's kind of fun to make these changes. But it becomes a certain part of the natural process. I mean, you get married and you have kids and you make accommodations for them as well. And, they get their own rooms and their own toys and their own stuff. So when suddenly it occurs to you that there's a kind of accommodation that might not actually be fostering the health of the relationship, it can be really jarring to have to change that. And I think I find a lot of family members are really hard on themselves about like, why did I spend so much time accommodating these rituals? Well, in any other context in the world, it would have been the right thing to do. And you're not a mental health expert, so that's why you were doing that. Okay, so now you know. And then how do you, over time, learn to understand like, it's one of these situations. So you can condition yourself through practice to just be better at it. So in the beginning, it might be, kind of white knuckling your way through the exposure of not giving the reassurance, the way people who start ERP themselves are kind of white knuckling their way through it. They're touching the dirty thing, but they're trying not to have the feelings. And then it becomes something where, well, for instance, my wife will occasionally say to me something like, is this one of those things where I'm supposed to let you tell me once and then never let you talk about it again? And it's all with a smile and she knows exactly what's going on. And then I know exactly what's going on. And then I don't even have to tell her the thing in the first place, right? As opposed to we have to go through this process where, I'm trying to push for something and she's trying to withhold it. And there's that intensity to it. It just becomes part of the language of the relationship.
And I guess that's really something I want to talk about because I know I have a lot of room for improvement, as do most of us. But how do you get to that healthy level of communication? And Ethan and I talk about this all the time, that when one of the questions we get a lot from OCD sufferers is, well, when do I tell someone I'm dating I have OCD, right? And I always say, like, well, not on the first date, probably, right? Like, sometimes, like with me, maybe I do because they Googled it me and they ask a question. I'm not going to lie about it. But at the same time, like, I typically wouldn't say, hi, I'm Liz and I have OCD, right? That's not how I open up. It's not how I introduce myself. But one of the things we've talked about is that as you slowly get to know somebody, right, and the trust builds and you're sharing more intimate details of your life, that's typically when I would disclose my diagnosis or journey with OCD. But again, that first disclosure also isn't that I also share every intrusive thought, right, and that I go into all these details. That's like an earned trust that you slowly open up more and more. And I'm curious how, for family members who've been there the whole time, right? They've seen it. Sometimes they're so enmeshed, right, that they feel like they can say things or do things that probably they wouldn't do if it wasn't their loved one, right? Their sibling or their daughter or son. How can we create what you just talked about amongst you and your wife of like, how can people create healthy communication? Because I think it's one thing to say it and for us to all know, oh, well, if I could just communicate better, it would work out. But it's another thing in practice when we're feeling anxious and we're feeling overwhelmed to not get into those, I need this reassurance, I'm not going to give reassurance, I'm not supposed to do this, yes, you need to do this, like these fighting battles.
Yeah. Well, I unfortunately, I think it really varies wildly from family to family. So different families as systems develop their own cultures and develop their own communication styles. So if you're starting with a family where the culture and communication style is assertiveness and honesty and patience, well, that's great. That's the easiest, right? And then you say, here's my need. Can you meet it? If you're not starting from that place, you might have to be more strategic about it. So first you need to learn about your own OCD and come to some conclusions about how personal it is for you. Like you said, I mean, for some people, they might say it on the second date. And for some people, they might say it 2 years into the relationship. Kind of depends on whether or not that person has earned the level of trust that you would disclose it and what level of trust it's at for you. You know, it might be very high or very low. So that might be true even with your own mother or your own sibling or something like that. Just because they've been around forever doesn't mean that they've necessarily proven themselves to be trustworthy with every piece of information you have about yourself. So sometimes you kind of have to throw out a line there of sort of, kind of not to be tricky about it, but slightly indirect of sort of like, here's a thing I'm interested in. What do you think about it? Oh, I think it's very interesting. I'd like to know more about it. Oh, good, because it applies to me, right? As opposed to leading with, here's the problem I have, and then having to go, oh my gosh, you have that problem? I don't know how to handle that. And then feeling like you've been rejected, when really what's more likely is they just weren't prepared to be that for you in that moment, and they got anxious, and then it felt like a rejection to you. So with some families, you have to kind of ask yourself, and this might be something you work on with your therapist, what is the communication style of the family, and how can I use my knowledge of that to, have the best success rate with opening them up to what I need from them. And sometimes that's showing them articles and books and directing them to websites and things like that. And sometimes it's just pacing the amount of information that you disclose strategically so that it's a gradual exposure for them to say, okay, I think I understand what's going on now. And in some cases, that might not ever involve the content, right? It might just be, I have thoughts that I get stuck on and I don't need to talk about them. I just need you to know that when I get stuck on them, here's kind of what's going on for me. And in other cases, maybe getting into the content is more helpful. Again, it really just depends on the family system itself.
Yeah, no, I think that makes total sense. And I think that, also for some of us, it's about like for me, when I'm struggling, I'm actually quite a big introvert. And when I'm struggling, like I just want to be alone. Like I need space. I need time to myself. And the way my fiance perceives that is that I don't want to be with him or that he's done something wrong. And we've learned that if I can just communicate to say, hey, I'm triggered, I need time, that little communication goes so far because it allows him to not feel like it's something he did or that I don't want to be with him, but in fact that it's just like, I need a little space to myself to deal with this. Because typically I know that when we're together, if I'm struggling, his desire is to know what's going on, which then often turns into me telling too much or confessing or reassurance seeking. And that's not really a path I want to go down. But I think for a lot of us, there's also this like, well, I don't have to tell you everything. And so it is, right? This is where that compromise is really critical. It's like, what are you willing to tell that's important? And we'll give them space, even if you aren't willing or you don't want to disclose everything, right? It doesn't mean you have. And I think we see this with parents all the time. When I've worked with kids, you see the gamut, as you do, I'm sure as well, where some kids want their parents actively involved in their homework and some kids want their parents not involved at all. And my response is always like, there's no right or wrong, right? It's kind of what you want. And as a parent, it's up to you to hold that space and participate if they want, but then also let them do the work if that's more important. But I am curious of how, as a parent, you feel like they can really manage the difference in being involved and being helpful versus doing the work for their child. Um, and I think it's really critical to think about, just because I know for individuals with OCD or as a clinician, right, you see sometimes where other people want it more than the patient themselves. And how do we make sure that the patients are learning the tools are their tools and that the work is their work?
Yeah. Well, there's quite a bit to unpack there. First, I just want to comment on what you were saying earlier about how you communicate that you just need a little space, and that it's not personal, right? It's not that you don't want to be with him. You don't want to be with humans, and he's a human, and that's actually you respecting his humanity by putting him in that group with other humans, and being able to explain that. So sometimes it's really important to articulate what it is you actually need, not just what it looks like you need. And this is especially true, not to go on a tangent here, but it's especially true with male-female gender dynamics, I find, where it's very difficult for men to be presented with a problem and then not feel like, okay, now what I need to do is solve that problem. So if you're saying, I'm really having an OCD trigger, and they're like, okay, well, here's what you need to do. But that's not what you actually need in that moment. What you might need in that moment is just support and encouragement, not someone to solve your problem for you. What you need to hear is, I understand you're not alone. Let me give you the space that you need to kind of work it out. Not, oh, well, why don't you do an exposure, or why don't you do this or that? So leading with this articulation of, okay, what I need to know is just that you understand that I'm going through a hard time. And what I don't need is for you to tell me how to address it. And sometimes people need to hear that literally. And we can't always expect them to intuit it. And then we can't. And when we do that, when we make that mistake of expecting them to intuit it, then we become resentful and passive aggressive. Like, well, you should have known to treat me that way. Sometimes it's very important to just be very specific about what you actually need, not just tell them what the problem is. In terms of your question about the involvement of parents in the ERP, so this is certainly not exclusive to kids, because adults do the same thing. They'll do the work with the therapist in the session, but then they'll struggle to do the homework on their own at home, because there's something fundamentally comforting about knowing that someone else is an observer of the ERP, knowing that someone else is driving the ERP, knowing that someone else is taking some responsibility if things go terribly wrong. If the uncertainty, if the fear turns out to be true, it's like, well, they made me do it, or they saw me do it. So whether you're working with an adult or a kid, whether it's the therapist and the client, or the parents and the kid with OCD, I think it always has to be looked at as someone is helping me with the exposure, as opposed to someone is making me do the exposure, or someone is doing the exposure for me. And in some cases where the parents are more motivated than the children to make the change, because the parents are really worried about the effects that these compulsions might have on the child functioning at school or in social life or whatever, and the child's like, this makes me feel better, so I don't see the point in changing. Sometimes we just have to work directly with the parents and say, well, let's take a look at the things that are reinforcing this obsessive compulsive cycle and see what changes you could make so that it becomes more desirable for this child to make the changes on their own. Sort of make them realize that actually this is my journey and I need to take it. And then they'll either ask for help, or they'll say, I got this, and they'll ask the therapist for help.
Totally. Sorry, I was muted. And, I think that as a parent, that can be really hard, because sometimes you want to be more involved than the kid might want you to, or a therapist might want you to. And I just want to speak for a second about how critical it is that family should be involved with the therapy, in the sense that you may not be, hounding them all the time or actively involved in their ERP. That's probably not useful. But at the same time, I know for me, having family members involved when I'm working with patients is critical, and it makes such a difference in their success. That doesn't mean the family's in every single session and that they're
right.
doing the ERP for them, but to just be able to have that third party, right? To have that OCD clinician and OCD provider really help guide, like, this is what I need you to do, and this is what would be helpful versus hurtful. That education, when it comes from a provider versus from the family member, usually is much better received. And so I do think it's important we talk a little bit about how critical it is for parents, even if you have an adult child, if they're living at home, how important it is for you to be in that process, but also significant others.
I think it's important to recognize too that OCD is a thief, right? It takes you away from the people you love. It takes you away from the activities you love. It can take you away from the philosophies that you love. And the goal is to get back to those things. And if you go on this journey, well, we should be interested in this family that you're coming back to. Are they the same as they were before you started therapy, or have they also been on a journey with you? Maybe their own journeys, but side by side with you, right? So we should be very interested in, okay, when the goals of treatment have been achieved, whatever that means for you, what is the family that you're returning to? And the best outcomes are always going to be, the family that was with me on this journey, that's also been through some changes, that also understands me better, that isn't quick to anger when I'm having a hard time, and isn't quick to reassurance when I'm having a hard time, but is quick to some equanimity and compassion and interest in how to help not just me, but the whole family. How can we all work together on this?
100%. So let's hop into some questions and then we'll continue this dialogue. Thank you for sharing your insight. Hi, so many different people. Hi, Ethan. Hi, Nikki from Ireland. We have people from Charleston, Madison, you name it. So we're going to start, Chelsea, with Winky's question at 11:34 a.m. Every time I feel down, I fear that I slide into depression. How can I accept my emotions and not fight with it? And Jon, I think this is a really important thing for us to talk about and think about, is just kind of how people can accept and lean into emotions, but also how do you recognize when it is becoming depression and when you need to be concerned about it in that manner?
I think the first thing to recognize is that emotions are not fundamentally different from thoughts, and you are not the author of your thoughts. Thoughts arise, thoughts fall. Emotions rise, emotions fall. And right now, everybody is dealing with all kinds of emotions. Your therapist is dealing with all kinds of emotions right now, I'm sure. Just this pandemic, it affects all of us. And depression comes from a lot of things. One of the things that it clearly connects to is the sense of isolation, the sense of disconnect from other people. So the first thing you want to do is recognize that, what you're feeling is down. Try to remember that this is a wave, that no feeling is permanent, and it's okay to feel down. And you're allowed to be a witness to that experience. Oh, look, I'm experiencing down. And the question is always, what would be helpful? It's not always the same as what do I want to do, right? What I want to do might be to isolate or to push people away. But what would be helpful might be to connect with people that I care about, or to do things that give me some amount of pleasure, even if I can't feel all of that pleasure right now. Of course, if you have a connection with a treatment professional, you want to be open and honest about what you're experiencing, so they can also ask important questions when this feeling of down becomes more of an issue of clinical depression, where we're talking about you're really losing interest in the things that you once cared about. You're really having trouble functioning. You're, having negative thoughts when you have OCD certainly shouldn't be some new thing, but sometimes the negative thoughts can be more biting or more pervasive or more unsettlingly appealing. And you want to be sharing that with your treatment professional so that they can ask you questions, to determine whether or not a more aggressive intervention is necessary than just, try to have this experience and be kind to yourself and let it pass. Sometimes we need to talk about medication or coming up with a specific, behavioral activation plan when we're really talking about depression.
Yeah, and I think even for OCD, I think that a lot of times we actually talk in OCD terms and not as much about some depression tools, but behavioral activation is really, or actually, maybe you can explain it, but one of the ways I would explain it is it's really finding things that you can enjoy and that you can do that will pull you out, right? And so sometimes when we think of BA, it's like, okay, well, we have to be excited for it. No, that's not the case, right? You might not always be excited to engage in BA. It's something like playing basketball, going on a walk, reading a book, right? Things that would be mindful. But once you do it, typically what we find more than not is that it made you feel better, or that it got you out of your element for a little bit, or that it kind of changed up the scene or situation you're in. And I think right now for people without anxiety, without depression, BA is critical, right? With everything going on, the more we stay isolated in one room in our house working, we don't leave our doors, right? And we just kind of stay inside, the more we start to feel like this is Groundhog Day and like we need to change it up. So can you describe kind of the importance of BA and the principles of it?
Well, it's certainly not my area of expertise, but I think you described it really well. And in simplest terms, it's very similar to ERP. It's about thinking paradoxically. The depression wants you isolated, in the dark, disconnected from people. And the paradoxical thing to do when you're feeling urges to behave that way is to behave the other way, which is get out in the sun, lift the blinds, play some happy music, dance, cook, do the kinds of things that your body is telling you you're not good enough to do. And the mind is the brain is surprisingly easy to hack in this way. I mean, ERP is the same thing. The brain is not particularly interested in what you think or feel or sense about an experience. It's really interested in what you do, and it's using that information to determine whether or not you should repeat that behavior or not repeat that behavior. So in ERP, we're trying to reinforce, when I'm triggered, instead of doing a compulsion to get certainty, I choose to be with the uncertainty. I choose to stay dirty or stay afraid or stay unclear about what I want. And then the brain goes, faced with that prompt, she doesn't seem to do anything. I guess this prompt must not be so important and worth investigating. And the intensity of obsession starts to drop as a result. Not because you felt great doing your ERP, but because you demonstrated back to the brain that this is how we behave in these circumstances. And so similarly to depression, you're feeling like, what's the point? There's nothing but dark clouds ahead. And then you go out and you do something that really a person would only do if they were feeling good. And you're not feeling good while you're doing it, but your brain, for some reason, I don't know why it's designed this way, but for some reason can't really tell. She played badminton. I don't know if she liked it or not, but she played badminton. She was out there swinging the bat and everything. So I guess this whole, what's the point thing is probably not worth investigating. And it starts providing you with more of what you need, which is this kind of inner friend that says, hey, things are getting kind of bleak here. Let's change things up. Let's get outside and do something.
And I think, BA is something that I think is just as critical when we're finding ourselves ruminating, right? When we start to realize that OCD thoughts are starting to take over. I can sit in my house, sit in my room and let the thoughts be there and try to investigate them and figure them out. But guess what? I'm going to get stuck in a much deeper OCD hole and be more triggered than if I still go to that Pilates class I had registered. Even if I don't really feel up for it, getting out and going is going to be a big difference for me and my OCD and my mental state of mind in an hour than if I choose to stay in bed. Yeah. And this actually relates directly to the next question, which is at 11:36 a.m. from Rahul. He said, thanks for the awareness and that we're creating for the OCD community, but I want to know how to get back to sleep in case if I wake up in the middle of the night and OCD thoughts begin to take over. And I think that this is something we don't talk enough about, sleep disruption and OCD. I know certainly in these webinars, we don't always necessarily get to it, but it's really important. I know for myself, when my sleep is really disrupted and I'm not getting adequate sleep, my intrusive thoughts are just on high alert, right? My kind of brain is scanning. I'm exhausted. I don't have as much energy to engage in ERP. And I think what Rahul is bringing up is really important, is that how do we address it, or what are some tools or tips that you would recommend when we're feeling anxious, we wake up with an intrusive thought, how can we get back to sleep?
So similar to my previous answer, I think the first thing you have to do is normalize the situation. When you're about to fall asleep, when you are asleep, and when you've recently woken up, you are not really yourself. You are yourself under very specific neurochemical conditions that are different from how you normally are. And so you're at a disadvantage. So this experience of waking up at 3 a.m. and the song that's been stuck in your head for a week now is so loud in your head, you think maybe you're even hearing it. And the intrusive thoughts about this, thing you think you did that embarrassed you or whatever it is, it just keeps playing on a loop. Well, part of that is that you're being affected by the chemicals in your body that are there for a reason, to kind of help bring you down and make you unconscious, but they also interfere in other processes in your mind. So it makes it difficult for you to think clearly and rationally. So first, understanding that, of course, your thoughts are worse in the middle of the night. They're supposed to be. You're just not supposed to be awake. You're supposed to be sleeping through all of that. And so you start from a position of non-judgment. And then the question is, okay, but what am I supposed to do now with my time and attention? It's frustrating, but the more you try to fall asleep, the less likely you are to succeed. And the more you kind of look at, well, what's the most helpful way to use my attention right now, the more likely your brain will kind of relent and let you fall back asleep. So what that might look like in some cases is actually just going ahead and getting up and engaging in some light activity, like reading a book or something like that. And then when you start to feel sleepy again, coming back to the bed. Sometimes there are sort of mindful games that you can play. The hardest part is the rumination, right? You're trying to figure something out and you're trying to crack the code and you're just at a complete disadvantage. The OCD is going to beat you every time when you're trying to do that, really across the board, but especially at 3 a.m. And so the trick is to catch yourself trying to figure it out and keep dropping down from that cloud. Caught myself figuring out, don't need to do that, don't need to do that, don't need to do that. So what do you come back to? I find it very helpful to do things like body scans to really kind of make an anchor out of the experience of my body pushing down on the bed. I have some games that I like to play in my mind of sort of either scanning the body or imagining that I'm moving the bed around the room with my mind. Sometimes it's fun to go on little journeys like, you know what, instead of trying to go to sleep, what I'm going to do is imagine that I'm putting on my shoes and going outside for a run. And I picture myself and I get sort of really involved in this task. And it kind of takes all of that noise in my head and brings it down to just one thing to focus on. And it's easier to drop off of one thing than to drop off of all of the things. Right. So those are just little tricks. I'm not a sleep expert, but I think the most important thing to remember is that trying really hard to get back to sleep is not very likely to work. And being open to the experience as it is and entertaining the idea that, yeah, maybe I'll be tired tomorrow. That's okay. I've been tired before. I can be tired again. That's the most likely to actually help you. Just like accepting a thought is the most likely path towards it kind of moving along, where we.
Yeah, and that was what I was going to end with too, is just that, also remembering that ritualizing, while it feels like, well, that's what I should do right now because it's going to make me feel better, right? And I'll be able to get right back to sleep. You're not. Like, that's going to get you more stuck. It's going to decrease your insight versus if you lean in, while no one wants to lean in at 3 a.m., we don't really want to feel more anxious. That is how we're going to have a higher likelihood that the thought goes away and that we may be in a place to be able to fall back asleep. So a couple amazing comments. Thank you guys. We are so grateful to be here and to be talking. Michelle said that she loves your book when a family member has OCD, and it's very helpful. One of the comments, some of the different comments about people trying to force normal to happen again and just encouraging others to be patient. We're going to move to Samantha's comment. She said that she's suffered for a long time and told her brother, who's 30, and asked for help because it became so overwhelming and she couldn't be in her home. He's supportive, but I needed to be out of my house. There's a second leg at 11:44. It says, and I needed some family support, but he didn't allow for that. And I felt rejected in the regard because my OCD is so bad. How do I cope with that? I love him so much, but I need family support.
No, what a painful situation to be in. That's really unfortunate. So, and Liz, maybe you can help me kind of distill what the question really is. So it sounds like she's reached out for some kind of support that the family member has basically given only a percentage of. They're sort of given support in words, but not in reality, right? Yeah.
And it sounds almost like you're sharing for the first time with your brother that you have OCD and you need a certain level of support, but he's not giving it. And I wonder, I'd be curious your thoughts, Jon, if maybe it'd be helpful for you to tell him what you need and how he can support you appropriately. Because sometimes the way our family members think they're supporting us might be hurting us and vice versa, but they may not know how.
Yeah, so I think the important thing is to figure out what the definition of support actually is there. Are we talking about there's something you need him to do, like help you find a treatment provider or help you with certain tasks that you feel are too hard for you to do right now because of your OCD and actually show up and help you with those tasks? Or are we really talking more about emotional support and say, I believe in you and I understand what you're going through and I don't judge you. And you just need to hear that so that you have the motivation to do the work yourself. I think it's important to remember some things too about when significant others fail to meet our expectations, sometimes it's just luck of the draw. And it's like, not everybody that you love who fails to meet your expectations suddenly, becomes a bad person, but they just might not have the tools that you want them to have, just like you don't have the tools that they want you to have. And so they may not be capable of giving you that support. They may be so wrapped up in their own stuff. They may not be capable of seeing you where you are in that moment. And that doesn't mean that they're bad people or that they hate you. It just means that they have their own problems, just like you do. I think it's also very common to get caught in this trap with OCD. And this is especially true, I think, in couples and in those types of relationships, where the OCD says, okay, I've disclosed my OCD, but I'm not sure they fully understand it. And so I need to keep disclosing and give them more and more detail, because I'm not going to feel safe until I know that my partner really gets it. And I mean, really gets it and understands what it's like to be me and have these thoughts. And the thing is, that's not possible. It's not possible to really understand what it's like to be you and have those thoughts, because you're the only one who is you and has those thoughts. So even if your partner has OCD, that just gives them a leg up. Maybe they're going to get it 90%. The average person maybe is going to get it, 75%. And like anything with OCD, you need to understand that the good enough mechanism in your brain, the part of your brain that says, this is good enough, we can move on, it's not as efficient as it could be. It sometimes misfires and it doesn't let you feel like something is good enough. And it can do that with disclosure too. It can do that with like, they don't understand me enough and I need to work harder to get them to understand me. When actually the healthier move would be to say, I've told them what I can tell them now. They understand me however much they understand me. Gee, I hope it's a lot. Whatever part of it they don't understand, that's just some uncertainty for me to sit with. That's part of my journey with OCD, is accepting that, maybe they don't get it. And I'm not going to wait to do treatment. I'm not going to wait to get better until I've gotten the approval of everybody else and they're guaranteed that they totally get it. They don't really have to. They just have to get it enough so that their behavior isn't holding you back.
Yeah, 100%. So let's hop into the next question, which is at 11:44 a.m. from Dottie. How do you help with contamination issues? And maybe you could speak for a second, Jon, just on ERP and how it works for the different subtypes, but what it might look like for contamination OCD.
So I like to tell my clients, actually, of all kinds of OCD, that all OCD is contamination OCD. It's just that some people have mental contaminants and other people take it, on a more literal level. So what we usually refer to contamination OCD might be a fear or difficulty accepting uncertainty about contact with, bodily fluids, chemicals, environmental exposures, animals, things like that. And with other forms of OCD, you might have a taboo thought and you might think, well, this is a contaminant on my identity and I need to wash it away with these rituals. So it's obviously a very broad question. I mean, the answer is ERP. And what does that look like? Well, what essentially it looks like is we want to figure out, well, what's the underlying fear there first? Is it that I'll be disgusted forever? Is it that if the contaminant will make me sick? Is it that I'll spread the contaminant and get other people sick? Is it that society will judge me as irresponsible if I allowed myself to come in contact with the contaminant? So when we're saying, hey, let's put you in situations where you want to compulse so that your brain can be a witness to you doing anything but compulsing, so that we sort of change the relationship to the uncertainty. We just want to make sure that we're doing it in such a fashion that's targeting that underlying fear and not just the obvious fear.
Right.
We want to get both of those. And then if we're lucky, we get both habituation and what might be referred to as inhibitory learning, meaning it gets sort of, the habituation component is you feel less distress, and the inhibitory learning component is the distress that you feel is something you're more willing to feel, right? So everybody comes to me with their stories, and the stories themselves are actually perfectly rational. Nobody wants to be sick. No one wants to get a disease. No one wants to make a mistake, et cetera, et cetera, et cetera. It's just that the behavioral way they're going about dealing with that, it needs to change, because it shouldn't be at the top of the pyramid of their life.
Sure. Yeah, no, 100%. And I think that, we had a couple other questions, like how do you stop from rereading and for this type of OCD. And I think that it's important, right? We won't go into all of these because we don't have time, but it's the same thing, right? The concept is that, you lean into uncertainty and you're willing to feel uncomfortable to get rid of these, the power that these thoughts have, right? So it's so important for us to remember that kind of, short-term pain, long-term gain, right? It's the same with OCD. Like if we're willing to feel uncomfortable and lean in, and so when we have the urge to reread, if we choose not to, and we choose to purposely also target the fear of like, maybe I missed something, maybe now I'm not going to do well on my exam, like maybe whatever the fear might be, we will actually get rid of that intrusive thought, and it will come with less frequency, less power, and eventually not much at all. Or when it does, you are able to see it as a thought and let it be a thought.
Yeah, I'll give you a little peek into Jon Hershfield OCD history. When I was a kid, I really didn't like to read. Well, when I was a little kid, I liked to read, and then at some point, I decided I didn't like to read because it was too much work. I think when the books got more wordy and less picturey, I realized that it was just really frustrating because I would read the same paragraphs over and over again because I would be left with this not good enough feeling, like I didn't understand it, I didn't picture it perfectly, and without any real discussion about whether or not I had OCD, I remember complaining about this to my father. My father, who's an avid reader, and I'm an avid reader now, I think he was a little frustrated with me that I wasn't taking this, interest in reading that he wanted me to take. And he's like, you don't have to read every word. And it's like, this was like amazing. No one had ever said this to me before. And like, he wasn't doing therapy with me. He was just, revealing his secret, I guess. So I started this practice of like, as I would read a sentence, if I noticed that I was stalling and getting stuck, I would just drop to the next line and pick up where the next line was. And so I would be reading like this in this kind of like funny little way. And then it just became more fluid. And, as it turns out, you're only going to retain a certain percentage of information anyway. And, most of the things you read don't come with quizzes. And when they do, you do this thing called studying, which is different from reading. And now I love to read, and I still do it to this day, where it's like, I don't know what they're talking about. Let's just skip a line and move forward. And now I'm not afraid of not knowing.
And leaning in, right? And I think for some of us, it's more anxiety provoking than others. And rereading can happen in emails, it can happen in books, it can happen in text messages, right? Different people can get stuck in different ways. But again, the principle of what Jon's talking about, we're saying, is that ERP can be used for any type of OCD. It doesn't matter if it's mental rituals, if it's outward rituals, if it's hand washing, right? ERP is used the same way. And that's what makes it such an incredible treatment. I'm going to kind of brush through because I know we have a lot of questions and not as much time, but Stacy asked what our thoughts are about the SPACE program. And I don't know how much you know about the SPACE program, Jon, but what I'll say is that it's pretty incredible, right? And the concept is that we can work with family members and individuals that aren't the individual with OCD, but people who support that individual, to teach them how to not enable and to not reassure, which in turn will help the person with OCD and may make them seek treatment. I don't know if you have any other thoughts.
No, I can't really speak competently on it. I haven't been trained in it, but everything I've heard about it is fantastic. And it seems like from what I've seen, it seems like an evolution of other similar approaches where I know Alec Pollard has his program for helping families of people who are treatment refusers, and John Grayson has his strategic pressuring, and they're just sort of like slightly different angles and different takes on this idea of what's really essentially a family systems concept, which is a change in one part of the system brings about change in all other parts of the system. And so sometimes the identified patient is not the one that's ready to change right now. Okay, so who is ready to change? Okay, you're ready to change. Okay, here's what we're going to change. And then it's just a matter of how do we do it compassionately as opposed to punitively.
Right, 100%. And we see it in particular a lot with adult children that live at home, where they may not be ready, the parents are feeling frustrated, but there is something you can do as a parent. And often actually you're as Jon mentioned earlier, the fact that we enable OCD doesn't make us bad people. You shouldn't get stuck on why, but it's human nature, right? To respond to people that you love, to try to help them and fix them, but you may not realize it's actually increasing OCD symptoms, and we can help you get there.
With my morally scrupulous clients, I have the same discussion, which is, listen, a mistake is something that you're trying to do right, and you later, upon reflection, realize you were misinformed. So there's nothing to feel guilty about. You were doing the right thing, and then it turns out new information came in, and the results indicate that you weren't doing the right thing. But that doesn't mean you were a bad person in the process. You were always trying to do the right thing.
Exactly. I love that. Good analogy. I'll steal from you. But so Nancy, I think I'll kind of combine both of your questions. But I know you asked earlier about, you said that you're starting to see a new provider who says they do ERP and ACT, and that there's an anxiety there, and then also asking for some help with hoarding. And what I'll say is that it makes sense and it's normal for us to be anxious when we first start treatment. And it's also important that we recognize that treatment is supposed to be anxiety provoking and uncomfortable at first as well, right? Like treatment isn't supposed to be fun and happy and easy. Treatment's hard. That's where we see the really good results. And so I think lean in, give it a shot, and remember that oftentimes people who treat OCD also can treat hoarding disorder, but then if not, there are specialists who do treat hoarding. And then Rakesh, I know you mentioned in California, if I am based in Houston, if we do online, you said that I see you're based in Houston. Do you do online therapy? And we do. We have one clinician who's actually licensed in California who can do ERP virtually, but there are also amazing clinicians in California that are ERP trained. And so I would encourage you to go to iocdf.org. They have a find help tab that you can put in your zip code and providers will show up, or you can also email us at info@peaceofmind.com and we'd be happy to provide some resources. Lots of people talking about kind of how they manage their family systems and what's worked for them or not. And it's great to see so many different perspectives and feedback. And I think that's important for us to remember, is that while we might share our perspectives and kind of what we've learned personally and or professionally, everybody has their own, right? There's no handbook that comes with this. There's no right or wrong way. It's what works for you and how do you navigate OCD treatment for yourself and your family in a way that's going to be most helpful to you guys. So Mary asked a question at 12:17 p.m. What do you do as a parent of an adult child that does not believe they have OCD? My adult child has harm OCD, religious scrupulosity, and other subtypes. She's in a facility now for almost 3.5 weeks to protect others, her belief. She's extremely depressed. My husband and I cannot say OCD to her at all. She shuts off from listening to us. Please help.
That's so painful and more common than you might think. People who admit themselves and they're able to get admitted because they're saying things like, I'm going to hurt someone or I'm going to hurt myself. And they're not looking at it through an OCD lens. And the compulsion is to get admitted. I've seen people who have tried to not only get themselves admitted so that they don't hurt anyone, but try to get themselves admitted deeper and deeper within the admission process so that they can't hurt anybody at the hospital either. Almost like it's this journey towards total isolation, which is the only place they imagine they could be safe. But of course, you can't run from OCD. It'll just go wherever you go. So first, I mean, it's as the family member who's writing this and who's struggling and wishing they could help, I think you need to shave off some of the responsibility that you're taking for this person's well-being, which I realize is the hardest thing in the world to do for someone that you love, but they are under the care of treatment professionals. And it is important that the treatment professionals are also doing their evaluations and determining the psychiatric needs of this individual. You can't be this person's mother and psychiatrist and therapist and social worker and everything else. You just need to define what your role is here, and then do the best you can to make space for that pain when your role just isn't set up for taking on this entire task. It's just you're part of the task. And then, if it's possible, if you're allowed to work with those treatment providers to help them understand what you're seeing, because maybe your daughter's not, fully disclosing, their experience. It never works to, this is a sort of extreme situation, but I see it in less extreme situations as well, where just people in the home, it's like, listen, I've figured out that you have OCD, and whether you like it or not, you have to treat it like it's OCD. It just never works out. I've seen people, to chase each other around the house with OCD workbooks, and I'm always gratified when it's one of my books, but it still doesn't work. So you have to really meet the person where they're at. And where this person is at is under the care of treatment providers, and it's kind of that they're going to have to pick up some of the slack there. And in the meantime, what's the best care that you can take of yourself? Is it helpful for your daughter to spend your day ruminating over how guilty you feel for not being able to help her? Or would it be more helpful for her if you were taking excellent self-care so that when she's ready to get better, you're ready to receive and help her.
100%. And a couple of people have asked questions, so I'll answer some of them quickly about, like, I thought the SPACE program was for parents, not partners. And I think while that may be the case, it is important to know that providers can always work with a significant other as well and can try to help them get their loved ones to a place where they may be ready for treatment. A medication question, I'm not going to talk about medication. We don't do that since we're not medical doctors, but oftentimes IOCDF may consider bringing on a psychiatrist to talk about medication. If not, on peaceofmind.com, we do have a webinar that Dr. Michael Janicki did recently that speaks really well to current medications and OCD. Our inpatient treatment program still accepting patients? And the answer is yes. So us here at the McLean OCD Institute of Houston, we used to be the Houston OCD program. We are reopening our residential support leg on Monday. So we'll be accepting patients again starting this Monday. Of course, there's some ways that treatment looks a little bit different with sanitation stations and masks, but we are accepting patients. McLean in Boston continues to accept patients at their residential level, and so does Rogers Memorial. One of the questions for you, Jon, is what info's been added to your new mindfulness workbook for OCD in the second edition that's coming out in December?
What's interesting is when I started that project, I don't even think I was fully licensed yet. And so I was writing about mindfulness from the perspective of, hey, look at me. I've read a lot of books about mindfulness and I meditated a little bit. And then over the last several years, I've really invested in a meditation practice and in retreats and in really understanding how mindfulness works. And so when I had a chance to update it a little bit, it was kind of funny going through it and realizing not that it was bad, but that I've evolved and sort of my understanding of mindfulness has evolved. So a lot of the change that's in there is really just an evolution of my deeper understanding of mindfulness from my experience, not just my experience of learning about it, but actually having experiential contact with it. I think initially I wrote it from the perspective of here's what I understand mindfulness is, as opposed to here's what the experience of mindfulness is. There's also some additional information in there about inhibitory learning and just sort of like different ways that you can work with ERP to take the emphasis off of I need my anxiety to go away in order to get better, and put the emphasis on I need to change my relationship with this trigger in order to lead a more fulfilling life. And I threw in a few chapters on other forms of OCD that I wasn't able to address in the first version. I talk about emotional contamination, existential obsessions, and false memories and things like that.
It is a wonderful workbook, and so I'm excited to see the next one. I know a lot of people have found a lot of relief from it, so it's amazing. I will tell you, the first time when we were in Atlanta and you were speaking on mindfulness and OCD, I remember originally going in thinking like, okay, what is this going to be? And I'm just candid, like back then we were just starting to hear people talk about mindfulness and OCD, and I think my original thought was like, mindfulness and OCD doesn't work. Like I can't sit through a yoga class without intrusive thoughts. How's this going to work? And I remember after your talk walking away going, oh, mindfulness and OCD is really ERP, right? It's mindfulness. I really used to think mindfulness meant like people sit in their Zen and they have no thoughts and it's just this amazing feeling. And I was just like jealous of it, right? But after your talk, I remember walking away thinking, oh, mindfulness isn't about having this clear, perfect mind. It's really ERP, right? It's about letting a thought come, not addressing it and letting it go away, and knowing that that's actually how we achieve peace. And when you think about OCD, like that's when our patients talk about experiencing freedom for the first time, having better insight, is when they don't respond to the thoughts and they just let them come and let them go, and they don't try to change them.
Yeah. The bravest thing you can do is treat your thoughts as thoughts. So you can call that mindfulness, you can call it ERP, or you can call it, paradoxical intervention. You can call it whatever you want, but that's at the top. That's the bravest thing you can do.
So true. So thank you so much for coming today and for joining us. I'm going to wrap up with a couple questions, couple answers, and then I'll let you take the floor as we end. What does the treatment process look like for clients in the first session? So Paul, this is a great question. Really, the first session should always be a intake. And the point of an intake is for us to gather information, understand your history and your current diagnosis and your current symptoms. What are you dealing with? What are you going through? So that we can decide what treatment intervention we would recommend. The first session is not a guarantee that you're going to work with us. It shouldn't be that, right? It should really be a way that we get to know, can we help you, and can we get you where you need to be in treatment, or is there another referral that we would want to give? And so the first session should be an intake, lots of information gathering. And then as we start to move into treatment, we typically start with psychoeducation. So we want people to understand, what does the treatment process look like? What can they expect? What is OCD? A lot of times we don't even realize half the things that are actually OCD we've been doing for years. We're only here for this one thing. And so we might think that's our only OCD or anxiety symptom. And then we move into the intervention stage. A couple people, lots of people have said how helpful these are. So thank you guys so much for joining. As always, you can always contact me through elizabeth@peaceofmind.com. And of course, if you're looking for treatment, higher level intensive treatment or outpatient care in Texas, intensive treatment, you don't have to be in Texas, you can visit us here at the McLean OCD Institute at Houston or give us a call. I will leave with my statement, and then Jon, it would be great if you're willing to share kind of how people can find you and look up what you do and be in touch. And also if you have any announcements around your book or different things, please share that next. But I will leave everybody with the statement I always leave you with, which is, thank you guys for joining. I know many of you who joined today, it was a feat to get here, to listen and to be present. But help and hope are always available, no matter how much you're struggling. Jon?
Thanks, Liz, so much for having me, and thanks for everyone who was in attendance today. I mean, we talked about a lot of things today, and but the overarching theme was the role of significant others. I just want to sort of mention that my experience is that people with OCD underestimate how good they are at making others significant. So having a significant other is not something that comes naturally to everybody, and having the kind of mind that picks out details, even though it can be a burden when you have OCD, it can also be an asset when you're noticing what's significant about another person and you're saying, I want this person in my life. I'm going to do what it takes to get this person in my life and keep them in my life. So even if your OCD is maybe causing some conflict or some difficulty in your relationship, try not to lose sight of the fact that that person is in the relationship with you by choice, and it's because you might be pretty spectacular. And just don't forget about that. In terms of where to find me, OCDbaltimore.com is my website. OCDbaltimore.com is my Instagram. And I have a Facebook page. I don't know what it is, but you can probably find me. And so that's where I'm posting all of my blogs and things like that. So I'm pretty easy to find.
Wonderful. Well, thank you for being here today. Thank you for joining us. I know that everybody found it to be an amazing webinar, and I'm excited that it will be posted after. People can continue to watch it and share it. Thank you for your time, Jon. We really appreciate you.